honestly, this is one of the things I want to talk about, natural asymmetries. When I see medial knee pain, right or left side, for some reason, it's only the right side or it's only the left side. And you were kind of alluding to this earlier when you were talking about, being right dominant. Why is it only one side? I rarely see, oh, my knee hurts on the inside on both sides. There are some natural asymmetries that we have that I think that are normal. Like even if you go deep inside our organs, we got a liver on one side of our body and not the other. In fact, the other side of our body has one less lobe of the lung and a heart, and our guts kind of go down on the left. So generally the right side is a little bit bigger. Some people are like, well, that's why we're all right-handed. I'm not here to debate that, but there are some natural asymmetries. And here's the thing, if you were perfectly asymmetrical, you would be like the chair that I'm sitting on right now that cannot move independent of some outside structure. So because we are asymmetrical at our baseline, we do have that freedom to kind of move off of that asymmetry. You had a good list earlier. What do you think some of the reasons are it's only one-sided?
It almost has to be asymmetrical by definition, because if you shift your weight over to your right side, if you're standing, everything is opposite, right? So your right hip is adducted and your left hip is abducted.
Should be.
Right? Should be. I mean, in a normal anatomical person. So
sure.
Those opposites have to occur. Those asymmetries have to occur. And if you're stressing the medial side of your knee, that is possible on both, but you need the same issue to be happening on the other side. And that's often not the case because we don't hop forward on two legs at a time. So we're not frogs, right? We walk in the sense of gait is asymmetrical. It is opposite arm and foot. It is, and then everything twists back to the other side. So somewhere in that machinery, you have lost the ability to do both. And that usually yields asymmetry by definition. So one side is going to start to become unlike the other one. And John mentioned we have some natural asymmetries, and that'll kick us off in a certain direction. That's for sure. So we have some natural ones, but then we have, what do you say? Just we've obtained them through the years. And
sure. Habitual?
Habitual, yeah. I mean, habitual or, yeah, exactly. I mean, when I gave my seminar a few weeks ago, the first half hour, I was talking about why we're in this mess, which is the fact that, we've had 250,000 years of being Homo sapiens and only 5,000 years of sitting on a horse. And we have even, 120 years of sitting in a car. You know what I mean? We just have, and we have, what we say, 30 years of sitting at a computer. It's just so limited in the amount of time that we've had to adapt to modernity that we have these issues. And part of this is for a CrossFit box, but my goal was to kind of give them a hug and say, hey, it's not all your fault.